Nancy?
Congratulations on your new position. That's, I'm sure, a big challenge and pretty exciting. If your field work is coming to a close, that would suggest to me that much of your budget, which has gone out by contract to these field assignments, might be coming home, and you can be thinking now, you know, what are we going to do? What's our next big thrust? What do you think your direction is going to be?
Well, first of all, I need to remind you I am the acting branch chief. So
Acting's good to act.
Yes.
That's when you call it acting.
Acting. Yeah, you do need to act, and we are now in the process of finalizing out this budget year, and I will be working with our group to really determine what is the next thing that we want to do. We had tentatively planned to do a second follow-up in the Georgia surveillance, which we did not get out into the field this year. And we're still debating whether indeed that is where it's most cost-effective to put our money, or whether we want to go into other avenues.
Thank you.
I wonder if you could elaborate a little more on the pilot registry.
I'm just going to pull out some of my papers here. The pilot registry is really not called, that's our shorthand name for it. The full name of it is the Registry of Unexplained Fatiguing Illnesses and Chronic Fatigue Syndrome. We started this in order to try to understand how a registry of chronic fatigue syndrome would work and what information we could get out of it. So we used it also as an opportunity to educate the healthcare providers who would be referring their patients to it. And what we found, we enrolled 828 healthcare providers, both physicians and non-physicians, practicing in Bibb County and the surrounding areas. So we tried to make it kind of a population-based referral, and educated all of these healthcare workers about CFS and encouraged them to refer any of their patients who met the criteria to be evaluated. Each person who was referred, of course, agreed to be referred, and then completed the same kind of questionnaire and actually had a clinic visit where they were evaluated for all of the CFS criteria, just like in our other surveillance studies. Towards the end, we also consulted with a patient advocacy group in Bibb County and allowed their members to self-refer themselves. And so we have just now completed that enrollment, and we have questions that we have relate to what kind of information we do have, how cost-effective it was to enroll in this way, what are other options for doing a registry. And interestingly, our preliminary look at the data is that the patients from the advocacy group actually have a lot more associated illnesses than those referred from physicians' offices.
Let me just mention one thing to you in case you're not aware of it. At ARC, we are very interested in patient registries, and in fact, we have developed a handbook to assist health systems that are interested in patient registries, sort of a how-to, if you will, and I'd be happy to share that with you. It might be helpful.
Thank you.
Lenny, and then Art. Destined to follow Lenny.
Actually, I had some follow-up questions, but before I even ask those, I just want to also mention, as Ken and Nancy has congratulated you for your succession term, that the openness in which you are engaging with us is refreshing, and we appreciate that. And it certainly indicates a new relationship with the CDC, which is very promising. Just to follow up a couple of questions, Art talked about kind of the relationship with research community. I'm just wondering kind of what you see your relationship with this particular advisory committee, and if you could kind of think about that, that would be extremely helpful for our members. Chris mentioned the empiric case definition and some issues that have come up with that, and I'm just wondering whether you still, as an agency, maintain that there are over 4 million people with this illness in the U.S. And Nancy also brought up the issue of succession, and I'm just wondering if you could give this committee just a little bit more information about that process. I know you're acting position, and what is the mechanism for actually selection of a permanent person?
Okay. There's a lot of questions there. First of all, as whether we as an agency, I don't know that I'm authorized to speak for the whole agency, but in the process of reviewing the very nitty-gritty workings of the case definition, we will revisit that number. I was involved in the decision to try to broaden the funnel of looking at patients or potential diagnosis of CFS when we did our original surveillance. And I was in favor of that because from everything that we learned about CFS, it appeared that the way we were asking the question, focusing only on fatigue, we did miss people who fully met the case definition. So I was expecting that the number would be larger. And I think that it is an interplay of both how we enrolled patients in, got them into the funnel, in other words, not asking the question so narrowly focused on fatigue. We do have to be careful that we aren't including people that really don't have chronic fatigue syndrome. And so we're going to go back and revisit it, but at this point I would stand by our number. And then as far as the process for a permanent position, this is CDC's role, and they are making progress. It's underway.
And the last question really had to do with kind of how you see your agency interacting with this advisory committee.
Well, that's why I'm here, to try to understand the work of the committee and try to determine how we can make this a productive interaction.